come on in.
Dr. Mich?
Yep.
Merrick Stob from Pernix Therapeutics.
How are you doing?
Doing good. How about you?
I'm doing pretty well. Plain busy day.
It's always good to have a busy
Always.
day. Just trying to get used to the cold weather all of a sudden.
Oh, I know.
All right, so for today, I know you know Treximet already, but I'd just like to see how many things you want to clarify on, and I want to see the need that you currently have for your patients for this. So currently, how many of your patients roughly suffer from migraines?
About 25% of my business, a quarter of my business is just migraine sufferers. So, there's a pretty large chunk of my business is just from migraines.
Which prescriptions do you prescribe currently?
Usually I start with Imitrex, and from there, if Imitrex isn't effective enough, I go to Maxalt. And for my patients who have a little bit tighter of a budget, usually we stick to Aleve.
Okay. With Imitrex and Maxalt, do you have any experiencing problems with quality with those drugs?
The biggest complaint is that they take too long. It takes about 30 minutes is a common complaint. And by the time that Imitrex is working, they've already been suffering for 30 minutes. That's the biggest complaint.
So when it's not working effectively, your go-to is mainly Aleve then?
Yeah, well, if the Imitrex doesn't work, is Maxalt, and if neither of those are working, usually my patients will try Aleve.
Okay.
Yeah.
And in these type of situations, do you ever find trouble keeping trust between you and your patients then, as a result?
I don't know about me, because my patients trust me. I have a pretty low turnover rate. It's only about 5% over the last 20 years. So
impressive.
So maintaining the trust is an issue, but it is something that my reputation with my patients and that trust is something that's what's most important to me, is making sure they trust me.
Reputation is
it's really important to me.
Alrighty. So you know the benefits of Treximet already, and you know the side effects of it. Is there anything further you want me to clarify on? You know some of them, but
I know it's a similar drug to Imitrex, but my main thing is it more effective or is it faster?
okay. With that, I'm actually going to direct you to our website. We have two sections of our website, one for you, and then one for your patients as well. It just makes it easier for them to access any sort of information they want and keep you up to date about our product. But what makes Imitrex different is the RT technology incorporated in its workings. It combines the two medicines, naproxen and sumatriptan. With this forming together, it actually helps to digest faster in the stomach, and actually it works much faster. With that, for example, you prescribe Imitrex.
Mm-hmm.
That typically takes 15 to 30 minutes to take effect after consummation. With our drug, it takes 9.5 minutes to take effect. This is roughly 3.5 times faster, which benefits both your client and you as well, in your reputation.
Yeah, I can already think of a handful of patients that would greatly appreciate a drug that worked a little quicker. So
yeah, they can take this at the first aura of symptoms that appear. So oftentimes they can almost completely avoid the pain.
Oh, so they might suffer the
migraine.
symptoms, but they won't actually suffer the full-on migraine.
Because just like the Imitrex, you'll take it once you start feeling the symptoms coming, and then it will just work more effectively and faster than.
So does this drug have rescue medicine that they would have to take later on?
Oftentimes they will not have to take the rescue medicine, because this would affect even longer than that.
Okay.
Which is great for both you and your clients as well.
Yeah, that's another common complaint from my patients, is that a lot of them don't like having to take the second rescue medicine later on.
And then the migraine just comes back.
Yeah.
How does this sound to you so far?
So far, it sounds really good. I mean, the only thing I'm worried about, would be, just my patients. Like, is this going to work? Is this something that's going to work for them?
We keep that in mind for you as well. We've actually had a couple different clinical trials to prove to you and your clients that this is an effective drug. We've done, You can show this to your fellow doctors if you want to show them a little bit clearer. But we also have it on our website. We've done two clinical trials with more than 2,900 adults that have been proven for the safety and tolerability of this drug. It worked effectively for them, and they approve of it themselves. And with realizing that migraines are occurring more often in younger adults as well, we wanted to make sure that this affects them as well. So we did 3 clinical trials through the ages of 12 to 17 years of age, and it worked effectively for them as well.
That's actually nice to hear. You know, most of my patients are adults, but I do have a few adolescent patients that suffer from migraines, so this is the first drug that I've come across that's actually been positive feedback for adolescents as well.
That works great with us too, because we want to be able to treat all patients of different kinds. But with this can help uphold your reputation. You work with other doctors as well, am I correct?
Oh, well, yeah, being in the industry for 20 years, I have a small touch of doctors, and they respect my opinion. I got a few younger doctors who seek me for advice. And, maintaining that reputation is really important to me too. I like to be viewed as like a mentor to some of my other doctors, and, a valued opinion can go a long way.
All right. They have young adults as well that they treat often?
Oh, yes, all of us do, yeah.
All right. We actually have a program along with our drug that we can offer to them and your older patients as well. It's a migraine tracker. This can help facilitate the conversations between you and your patients to see if Treximet is working better and more effectively for them. It's just a simple little pamphlet that they can print out and show to you. They put in the time when it starts. They can better grade it along this little chart here. And then you can look at this as well, and this would just help on a daily basis for them to remember the migraines, because this is an acute migraine prescription, so this would only affect short-term processes.
Okay. I do like this because, a lot of my patients, I'll talk to them and they'll tell me, oh, I had a migraine, Tuesday night. But it's hard for them to say the exact time. And I say you could log the time. And sometimes after talking to them after a few days, it's like, oh, I had a migraine, and it wasn't that bad. But, in the moment, they might think it's that bad. It could be severe. But after a few days, like, oh, it wasn't too bad. So this is really nice.
So does this help you want to go with Treximet then? Or
yeah, it does, definitely. This along with the quickened, effect. But my only thing now is price.
Price is a factor. We do admit that it can run a little bit more costly because of our drug, but we also acknowledge that, and we want to help both you and your patients with that as well. We have a program. It's a copay program that they can take to their pharmacist, and they just simply print out this coupon, and it'll be a co-op, and they could pay as little as $25 for the prescription.
Oh, so that's not too much, because there is a small portion of my patients, and they have to stick with the Aleve. They can't usually afford Imitrex or Maxalt, but the majority of them, the majority I would say could afford the $25.
And if that doesn't work for them, they can also fill out the bottom part and send this to them, and we will do our best of our ability.
Oh, so you guys will help them too if they need it?
Yes, as long as they meet our certain qualifications listed here. They're not currently provided by Medicaid and a few other situations as well. But we fully believe in our drug and helping our patients as well as yours.
Thank you. And then one other thing that I'm worried about is, because a lot of my patients have been taking Imitrex for some time, so how would they go about switching?
Switching over is relatively easy. If they're taking Imitrex or other medications that have tripans or ergotamine in it, they simply have to wait for 24 hours to let it flush out of their system, and then they can start taking our drug, as long as they consult with you beforehand and don't have too many other symptoms.
And we could test them to see if that stuff's still in their system. Okay, that's not too bad.
Alrighty, now that you know even more than before, would you consider setting up a time to sign up a contract, or would you need further discussions?
I'm going to need probably at least a few days to a week. I'd like to talk to a few of my other peers and doctors to see what they think about the drug, and maybe bounce the idea off a few patients to see if they're actually interested in switching, or just how comfortable they would be switching.
Okay, I understand.
But I could definitely set up another meeting, and I would be, bring a contract just in case, because as long as it
I
all
have
goes
one
well,
ready for you to sign.
right, as long as it goes well talking to everyone, then, I'll be willing to sign next week.
Alrighty, does Friday work for you?
Yeah, Friday, probably after 2 p.m. would work, anytime after 2.
Alright, let's make it for 3 then. And then I will see you there.
Okay, thank you very much.
Thank you for your time.